from your list. Yes, probably yes. Okay, so the veins from this specimen is visible. No, I can see the vein. Here is veins. The great cerebral veins is visible. Okay, so what is the first for your list? You remember? Yes. Lamina terminalis. Okay, so the lamina terminalis is visible here. Yes, this one, the white structure here. Lamina terminalis. The next one?
Rostrum of corpus.
Or maybe anterior commissure, no?
Anterior commissure.
Yes. So because I see it here, this one, circles, you see? This one? It's an anterior commissure. So this one. The lamina terminalis, anterior commissure, and the part of the corpus callosum. So the first one is a rostrum, yes, genium. Here is the body, or the trunk, this is the same, yes, and the splenium of the corpus callosum. The next one? Septum pellucidum. From this specimen is visible, of course, yes. So this one is a septum pellucidum. We mark like this. The next? Parietal occipital sulcus. This one, yes. So I mark you like this. Parietal occipital sulcus. Central sulcus. Central sulcus, you know, we have two different positions and it's possible to mark. If you look here, this one is a central sulcus, visible from a sagittal section, yes? So here you have a paracentral lobule, central sulcus, or from this. And I think I give you the 90% chance we marked the central sulcus like this, using the hemispheres from the superior-lateral aspect of the brain. Yes? Yes, okay. Central sulcus, lateral sulcus, yes, it's visible here. And like this, lateral sulcus, or which artery I marked now?
Middle cerebral.
Middle cerebral, perfect, yes, middle cerebral artery I marked now. So to answer now is correct, but we try to mark like this, lateral sulcus. Cingulate.
Above cingulate.
Cingulate gyrus. The which one?
Cingulate.
Collateral cingulate. Okay, so the here you see it's a cingulate gyrus. Collateral gyrus is visible. I must look here from the middle position. This one. Yes, here. Sulcus. This one. Yes, this is a sulcus, you see? So this one. This is the gyrus, collateral. Here you have a sulcus. Sulcus separate the limbic aspect, yes, limbic formation from this one is the temporal lobes. Okay. This one we have precentral gyrus is easy, and I'm sure we mark it. We like mark this one. Precentral gyrus, postcentral gyrus, and you have all paracentral lobules. Yes, so you must remember we do not have the gyrus, only the lobules. So it's here, where it mixed the fibrous sensory fibers with a motor fibers.
It's lower limb, right?
Yes, exactly. So here you have the part, so small part of the frontal lobe and parietal lobe. So here we have a commissures, yes, and the fibrous commissural fibers join these two regions for a lower limb sensation and the motor.
If something happens to this, then we
Well,
get paralyzed.
Of course, where we have, yes, occluded this artery, here is not supply, so we have a paralyzed syndromes, yes. And olfactory, here is visible, yes, olfactory sulcus and two gyruses, you see? So the first gyrus, oh, this is the olfactory nerve, olfactory sulcus, and with gyrus, straight gyrus. The next one, orbital gyruses, this and here. So the medial and lateral. This is depression. Okay, what I marked here from this depression, are you sure now we are from the position of the orbital gyrus? And the next one? We mark it. And this one is what? precuneus. Precuneus. So the precuneus is here, yes? Like the quadrangular space here. Precuneus, and this must be the cuneus, of course. And the cuneus is a shape like a triangle. Exactly. The base refer to the parietal occipital sulcus. Exactly. And superior temporal. This one. Yes? Superior temporal gyrus. And the next parahippocampal gyrus. Here is visible this one. Here. So this one. Parahippocampal gyrus. Cuneus. Yes, so back here. Cuneus. Calcarine sulcus. This one. All of what we see here. Where we cut here, we open which horn? Posterior horn of lateral ventricles. And you remember here, originate the calcar iris is continued by a calcarine sulcus. Yes. Lingual gyrus, this one here, is continued like a parahippocampal gyruses. And short and long gyrus of insula from this specimen. Maybe, no, it's not visible. Here is only the palpated. So when I have like this projection, I show you, yes, today's. But now we concentrate.
How many short gyrus does lingula,
is
insula have?
visible? Two longs and the three or two.
3, 4.
Yes,
Yeah.
shorts. And this one long, so I show you. And the last one of corpus callosum, sulcus of corpus callosum. All of this, yes, it's like the here sulcus. Gyruses is like the here eminence. Depression is always sulcus. Is easy, yeah. So the hippocampal formation. This is not here. I do not have here the hippocampal formation. The next, so we back from this, okay? Gray matter here is not visible.